Patrick's respiratory symptoms are coughing regularly and dyspnea. The main factors that appear to have contributed to his respiratory problems are his age and lifestyle choices such as smoking and weight. Age can have a major impact on the respiratory system due to the structural and physiological changes to the lungs that come with aging. Patrick's left-sided heart failure contributes to his respiratory symptoms as the buildup of excess fluid can lead to shortness of breath. Patrick's biggest lifestyle factor which has contributed to his respiratory symptoms is smoking. Smoking causes numerous respiratory issues as it deposits tar with every cigarette, which builds up inside the bronchioles and then eventually throughout the entire lungs. The likely sequence of events that have contributed to Patrick's current condition is that smoking for approximately 40 plus years has done permanent damage to his lungs. Patrick's lungs have most likely lost elasticity and shape and can no longer exchange oxygen efficiently. As Patrick aged, his lungs deteriorated further as around the age of 50 there is a homogeneous degeneration of the elastic fibers around the alveolar duct, which results in the enlargement of air spaces. The reduction of the supporting tissue results in premature closure of small airways during breathing, which can potentially cause air trapping. The damage to Patrick's lungs and respiratory symptoms have led to the development of chronic obstructive pulmonary disease, also known as COPD. Patrick's heart rate is 155 beats per minute, which is abnormal as the average heart rate for a man his age should be between 70 and 100 beats per minute. But the factors that have contributed to Patrick's incredibly high heart rate are BMI, weight, low activity, blood pressure, dyspnea, and smoking. Based on Patrick's height, weight, and age, his BMI is 29.3. A high BMI and being overweight increases a person's heart rate dramatically. A strong, healthy heart beats slower because it is able to deliver a greater volume of blood with each beat. However, when a person is overweight, the heart has to work overtime due to the extra body fat causing restriction on the flow of blood through the arteries and veins. Based on Patrick's BMI and his swollen legs, which cause him to walk very slowly, it can be assumed he lives a low active life. The heart is a muscle and can be weakened from inactivity, which results in the heart trying to compensate for its weakened state by beating more frequently to meet the body's oxygen demands. Patrick's high blood pressure could also be a factor contributing to his elevated heart rate, as a common feature of hypertensive patients is an increased heart rate. Due to Patrick's long history of smoking, it is also a factor contributing to his elevated heart rate. Smoking causes the veins and arteries to constrict, which results in the heart working harder than usual to pump blood around the body, which means the heart rate is increased dramatically. COPD is an umbrella term used to describe progressive lung diseases, including emphysema, chronic bronchitis, and refractory asthma. Common signs and symptoms for COPD is increased shortness of breath, frequent coughing, increased breathlessness, wheezing, and experiencing tightness in the chest. COPD is caused from the damage of the airway passages in the lungs from smoking or other toxic particles, such as workplace pollution, dust, or smoke. COPD causes the bronchial tubes and the alveoli to lose their elasticity. The loss of this elasticity allows for the bronchial walls to overexpand and can collapse, resulting in air, irritants, and mucus to become trapped in the lungs. Patrick suffered a myocardial infarction to the left branch of his coronary artery when he was 68 years old. This cardinal infarction can commonly lead to heart failure. Left-sided heart failure, also known as congestive heart failure, occurs when the left ventricle doesn't pump as efficiently as it should. This prevents the body receiving the supply of oxygen it requires to function. Because the heart is not pumping as efficiently as it should, the blood then backflows into the lungs, causing a pulmonary edema. Because the alveoli are filled with fluid instead of air, this causes difficulty in breathing and increased coughing as the lungs try to expel this excess fluid. Left-sided heart failure is commonly caused by increasing age, hypertension, abnormal heart rate, diabetes, or coronary heart disease. While there is no direct relationship between COPD and left-sided heart failure, these two conditions can exacerbate each other. The low oxygenated blood supply caused by COPD places further strain on the heart, further exacerbating the symptoms of the left-sided heart failure, and because of the excess fluid buildup in the lungs caused by the left-sided heart failure, this can make breathing more difficult. Those that suffer from left-sided heart failure are at risk of developing right-sided heart failure. Right-sided heart failure is caused when there is an increase in left ventricular pressure and blood is then reflected back into the pulmonary circulation. As this pulmonary circulation pressure rises, the resistance to the right ventricle emptying increases. The right ventricle is unable to compensate for the increase in afterload and begins to weaken and eventually fails, leading to excess fluid buildup in the lower extremities, liver, and other organs. COPD can have a direct impact on the heart's ventricle, resulting in right-sided heart failure as the body tries to compensate for the low levels of oxygen in the blood. The blood pressure in the arteries increases, which can lead to pulmonary hypertension, which places excess strain on the right ventricle and increases the ventricle's workload and increases in size. The ventricle becomes weaker and loses ability to pump blood to the lungs, leading to the development of right-sided heart failure. Patrick's sodium levels are 150 millimoles per litre, which are abnormal and found to be higher than the normal range. High sodium levels are referred to as hyponatremia, which involves dehydration. Patrick's age of 78 might be a contributing factor for his high sodium levels, as elderly people are at risk of dehydration due to the decreased thirst reflex and less fluid in the body. High sodium levels affect neurological function as it can lead to confusion, seizures, and comas. Patrick's potassium levels are 5.2 millimoles per litre, which are found to be abnormal and high. High potassium levels are associated with hyperlipemia, a term given to high blood potassium levels. Patrick's potassium levels could be high due to medications he may have been administered, such as ACE inhibitors for hypertension. High potassium levels can be associated with neurological function issues such as a feeling of numbness and tingling. Patrick's calcium levels are 2.05 millimoles per litre, which are found to be abnormally low and can be referred to as hypoglycemia. Patrick's diet and age could be a factor contributing to his low calcium level, as he could not be consuming enough calcium. Patrick's hemoglobin levels are 111 grams per litre, which are found to be abnormally low. Anemia is a medical condition in which there is a less red blood count or hemoglobin. Anemia is caused by loss of blood, age, nutrition deficiency, and kidney failure. Patrick's low-density lipoprotein or LDL levels are 3.5 millimoles per litre, which are abnormally high and indicates risk of heart disease and stroke. Patrick's factors that contribute to his elevated LDL results are smoking, hypertension, overweight, and age. High LDL can have a major impact on neurological function as it can cause severe cognitive impairment such as dementia and Alzheimer's disease. Patrick's HDL levels are 0.8 millimoles per litre, which are slightly low. Patrick's contributing factors to his HDL levels are his weight, exercise, and smoking. Patrick's triglycerides levels are 4.2 millimoles per litre, which are high and contributes to a higher risk of heart disease. Patrick's weight and diet both contribute to his elevated level. Patrick's glucose levels are 8.5 millimoles per litre, which are abnormally high. High levels of glucose can indicate diabetes. Patrick has a high chance of developing diabetes due to his weight, as extra weight can sometimes cause insulin resistance. Diabetes can cause cognitive impairment and cause a high risk of developing dementia. Arterial blood gases are frequently used in the management and diagnosis of COPD and other respiratory disorders. This test measures the oxygen level in the blood and if carbon dioxide is being removed. It also assesses the acid-base levels in the blood. In those with COPD, the pulmonary gas exchange is so compromised that the rate of carbon dioxide production in the tissues exceeds the rate of carbon dioxide being eliminated in the lungs. Normal blood pH is between 7.35 to 7.45. Acidosis is considered when pH falls below 7.35. In those with COPD, the blood is more acidic, as the pH levels are low and the PaCO2 levels are above the normal range. It is expected that Patrick's test results would be abnormal due to his COPD.